Hi everyone, welcome to our Heidi webinar. We're going to be going through some really interesting stuff today. We're going to run through some quick intros and then we're going to talk through a typical use case for Heidi. And then we're going to talk through a couple of other more unique cases, and Sam is going to showcase how he gets the most out of EMIS and out of Heidi at the same time. So by way of intro, my name is Hannah Allen. I'm a GP by background, and I'm also Chief Medical Officer at Heidi. Sam, do you want to intro yourself?
Hi, I'm Sam Ashley. I'm a GP in North London and seem to be an emerging expert, or I don't know. It sounds arrogant to say that, but a passionate user of Heidi, I think, is a good phrase to use.
I think you're a natural clinical informaticist, right? You're
Yep, no,
very
that sounds
eager.
great.
Brilliant. Okay, lovely. So, why don't we start, Sam, with a kind of typical use case that we would use Heidi for. Perhaps do you want to talk through how you've got your setup? You showed me this earlier, and I said, oh, "How have you achieved that?"
Yeah,
A
I
nice
mean it's
clarity.
one of the most important things I think is to try if you can and use split screen functions on your computers. Latest forms of Windows all have it. You just have to drag your window to the top of the screen, and I just think it's really useful to have something on the right and something directly in front of you. So in this case, I've got Heidi open on the right, but I might sometimes have things like Docman, um, things that are designed for portrait view, which documents are, and letters appear perfectly well here. And then often you can have that as your patient-facing screen, and perhaps on your other screen, if you're blessed with a second screen, you can have your other bits and pieces. So yeah, this is the setup that I normally have in a clinic. And I've created this sort of fictitious clinic for us to run through today. And I've got Heidi already just on the right.
Nice. And we've got 30-minute appointments we'll be delighted with, Sam.
Yes, we are. Yeah, the mouse family. They're known to take a long time.
Brilliant. Okay. Well, perhaps we could just run through a really quick case to showcase how to actually use the transcription function of Heidi and to sort of generate some documents, for example. So if I'm a patient coming in to see you and perhaps I've got a viral illness, let's say.
So yeah, first thing, obviously when patient comes into the room, you just need to make them aware. So the standard thing that I always say is, hi, just by the way, I use a software that's just listening in the background. It's just helping me write my notes. Is that okay?
Yeah, of course, that's okay.
So I'm sorry to hear you're unwell. Could you tell me a little bit more about what's been happening?
Yeah, so I've just been feeling like really congested and just pretty awful over the past like 5 days, I think. Seems to be getting a bit worse and just feeling really lethargic, sort of not really wanting to do anything, a bit snotty and kind of a bit of a cough as well, and just a bit sort of hot and cold and a bit fluey. So yeah, I just wanted to kind of get checked out because it's been going on for a while.
Yeah, and I could see, I was going to ask if this has happened before, but I actually had a look through the record and I could see that you've been in, I think it's 4 times. You saw Dr. Smith, I think, a couple of weeks ago, and it looks like they prescribed you doxycycline, I think the antibiotic.
Yeah.
So just recognizing you've actually been unwell quite a few times. I'm sorry to hear that. Is this one feeling sort of in any way connected or similar to the last ones?
Yeah, it does feel quite similar to the last time, actually. And that antibiotic seemed to work. I was wondering whether I might need another course or a blood test or something like that.
Yeah, it makes sense. Well, I've just had a quick listen to your chest examination was totally normal today, and I can hear and see that you're breathing okay, which is really good as well. And yeah, your oxygen level is perfect. It's 98%, and you've got a really solid heart rate at 72, and your temperature is normal. So I actually think this is a slightly different episode to the previous ones, and I don't think in this instance this is something that we need to be giving antibiotics for.
Mhm.
But what I'll do is I'll send you some information afterwards just to summarize what we've talked about today, and just some bits and pieces for you to look out for. And particularly, I'm thinking around changing in any breathing that you experience, or if the cough gets more productive,
Mhm.
or if you start to get any fevers. We didn't talk about that. So if you do get fevers, then let us know.
Okay, that sounds great. Thanks, Doctor.
No worries.
Bye bye.
So I intentionally peppered that with some information, which I'm really hoping demonstrates what I really value in this type of consultation. That this is bread and butter GP things, but the level of detail that you want to put into your notes really varies. But for me, I really want to know about that context. I want to hear that you've seen Dr. Smith in the past and that you've seen these changes. It's really, really useful to show that. So I'm just going to slightly alter my split screen there just so we can see what's generated. I mean, look at that. It's got all of the things that I wanted it to bring, and we all know this, but you can dial up your consultation to be super high detailed. You can put quotes in. These are the kind of things that I like to see. It helps me remember patients. It's little things like that. It's the things that we've spoken about that help draw down. And I know that my colleagues now look at my notes / Heidi's notes, and it's easier to follow what I was saying and what I've made reference to.
Very interesting. Thanks, Sam. So, Sam, because sometimes we do get some GPs saying, oh, it feels a bit robotic. How have you altered? What have you done there?
So what I've done is I've written a template myself that works with my style, and I've used it under certain headings, and I've asked it to sort of keep it quite condensed. One of the other big things that I really value is having a nice, easy flow when it goes into EMIS. I want it to be instantly readable. I don't want it to truncate, and so you can configure that. And as I said, I want a lot of detail there. I want it to capture some of the things that I said or some of the things that you said.
Nice, thank you. Cool. And I can see there on the right, we've got our task.
Yeah, brilliant. And so at this point, I find this invaluable. I think there is a lot to be covered in consultations. And while people could signpost or you could signpost to other guidance, why not give bespoke? Why not say, these are the things that I specifically mentioned? So you could at this point use the Ask Heidi function to say, please summarize the consultation today for the patient. I use this a lot with children. If you're giving really intense information, I say intense, but sometimes just even dosing. If you've got a 3-year-old who's really unwell, you're not going to remember how many times I told you to take paracetamol and ibuprofen. And so if I can summarize that and say it in the consultation, I know that Heidi will pick it up. And then it will send all of the things that I wrote. Those 3, I had to think on the spot, but those are the 3 red flags that I felt like highlighting today. But just it has amazing feedback from patients. It feels like you're really customizing their care, and it really feels that you are giving a lot of information and that you're listening to them as well. And I just find that really helpful.
Nice. I think that's the key bit, isn't it? That patients feel more listened to, and ultimately, that's why we're here, to give good care that is having an impact, right?
Yeah, and time saving. Historically, I would probably send a pre-populated document, which would be probably more clicks, and finding the right template, checking it's contemporaneous, up to date with all the guidance and things. It's hard to do, whereas this is just a few clicks and is going to give people a lot of comfort and reassurance. So yeah, it's great.
Awesome. And I think, Sam, if we're on the latest version, if you go up to the task and you click on the right-hand side, it should give you an option to say generate document. So anything that's generated on the right-hand side in tasks, so referral letter onwards, for example, you can generally generate off that task, which is really cool. I like that. It's one click.
Amazing. Yeah, it's such a good quick reference as well. You find yourself going back and forgetting. It's really, there are so many components for our consultations, and just having that, and we know this, but the nuance of it will pick up sort of generate the blood test form, update this person, book that appointment, all of those things that you would just get lost historically. And it's one of the first reasons and values that I got from this software was I used to and still do run quite hectic clinics, and I forget stuff and I don't have time to format all my notes. But knowing that that's happening in the background, listening, writing, documenting for me is such a relief.
Yeah, it's amazing, isn't it? I end up at the end of a clinic with a sort of A4 sheet with scribbles on it and me going, oh, what was that again?
So true. I think
Yeah.
we all do. I guess on that theme of running out of time and chaos that we all have in our clinics, this is an example of how I use Heidi retrospectively. I might use this for patients, but I also use it sometimes for debriefs as well. If I've run into someone else's room and given some advice, I think it's really important that I document that. And so I might run back and do that. But let's use, I guess the context for this fictitious case was, imagine I had a mental health consultation earlier and I didn't have time to do it at the time for whatever reason. Perhaps they were in the waiting room. If we really want to be super contextual on this, maybe it was someone having a panic attack in the waiting room that I went out and helped. But then I've come back into my room and I need to put something in the notes, and I also need to write the referral. So what I do, you just pretend. You just pretend that they're either there, or you can just dictate. So I would say I just attended a patient in the waiting room, a 32-year-old lady who came in having a panic attack. It was really hard to calm her down initially, but we eventually did make a bit of a plan. I know that she's tried quite a few things in the past. She's tried CBT, she's been on sertraline, she's been on venlafaxine, and none of those have really worked. But we did agree that we would try a short course of beta blockers. I explained how to use them, and that we need to be cautious with her heart rate in particular. And so if she gets any dizziness or if she doesn't feel well taking them, she can let us know. But I've also booked her a follow-up with me next week at 5:20. So she's going to come back for an appointment to see me then. Meanwhile, I've said, given that CBT has been ineffective, I'm going to refer her to the core mental health team, which is our local mental health service. So just under a minute. I don't think I would ever be able to type faster than that, but just so useful to kind of recount those sort of chance encounters. And I want to show specifically, once it's generated the note on this, one of the workflows that I've created called a snippet within Heidi to make this easier for me. So brilliant. It's done a fantastic note. And what you could do at this point is you could just write, I've created a little shortcut where you took / and core team questions. Now, what specifically I'm asking it to do at these point is answer these questions that I've pre-written. So I'm asking it to format the referral in such a way that answers the questions that the referee wants. And this has had enormous good outcomes for us in terms of our rejection rate. It's just gone through the floor. If you just give people exactly what they want in a format that they want it, click the button, it will generate it, and I can just put that into my referral letter straight away.
Brilliant. Okay, so, and we've got 3 other cases that I think are really interesting to run through as well. And I know that you've spent quite a lot of time thinking about the workflow, not only on the Heidi side, but also on the EMIS side. And so it'd be great for you to be able to kind of showcase how that works together and how that really helps you and supports you in saving time for you every day.
Yeah, I think this is the more advanced use, but shows how you can just use stuff that's already in EMIS to extract and provide information for Heidi for you to make something that's normally quite arduous a lot more seamless and less time consuming. So I've got a series of test patients here, and they're all slightly different angles, what I'm going for. So what I've built is in the background in EMIS, using their protocol launcher software, which most people know as F12. I've created something in conjunction with the ICB. They asked me to create this template generator, for want of a better phrase. And when the user comes first to use it in EMIS, it just tells you what you need to do to make it work. But in really simple terms, all this is doing is I've hidden in the background of EMIS, I'd like you to create this for me. Please get this information, and here are the rules, here are the parameters that I've set to make it safe, to make it functional, and to really optimize Heidi and work with the safety components that Heidi has already. We sometimes notice that Heidi might refuse to do something. And so if you've written your prompts, if you've written your instructions safely and within the AVT guidance, which is what I've done in the background of all of this, then it can produce some really good work for you. So yeah, so this is just what pops up. I've actually created 7, I think. Can I count? Oh, 8. I've created 8 different commonly arduous, time-consuming workflows that I use as a GP. And we'll start with a safeguarding report. Did you have a process? I can tell you what my process was, Hannah, but like, what did you do previously? What was your way of compiling a safeguarding report?
Yeah, I mean, look, it's really arduous, isn't it? And super time consuming. I always slightly, yeah, it would throw me
Yeah.
as to how to kind of compile all of the salient parts.
What?
And I'd often, I'd often be, because I've always worked as a salaried doctor, I'd often be going and trying to speak to others about, said child, for example. But yeah,
Yeah.
to hear your thoughts on this as well.
No, definitely. It's getting that data, isn't it? It's hard, especially if you don't have the context, but also things are subtle and nuanced. And I'm contrasting this to how I was taught it, which was by the safeguarding lead of one of the boroughs locally, which is they said, what I want you to do is have a notepad open on one side of the screen and be pulling information across about all of the different components of the family. And I mean, on reflection, that's really time consuming, but also not great for kind of data handling in terms of where you're storing that. So what I've tried to do is use those things that I used to draw out, those bits that I used to pluck from the records and put them into somewhere safe, which is Heidi. So when when you use this this template, this protocol, as I said, it's thinking because it's pulling from the entirety of the record. We'll talk a little bit later on about how I think people should go about that. But what I will say at this stage is this is a draft. So much like anything that's being formed by technology, you've still got to apply your brain to it. What I'm asking it to do is I'm asking it to look at the medical record here and provide information about safeguarding. So specific things I've asked for that we all know to look for, but perhaps some people don't, or sometimes you don't have the time for. And I've built lots of prompts within this to make it safe, make sure that we're not hallucinating. And all you do is you cut and paste it. So you take the whole extract that's been automatically generated in EMIS, and I'm going to get rid of the quaff box. We're not doing quaff today. And I'm going to put it into Ask Heidi, and then just once it's pasted, hit enter, and then just give Heidi a second to have a think about it. In terms of what I've actually done, I think it's useful to kind of look behind the mirror. What I've done is I've gone into this record yesterday, and I've put lots of little entries through the record, and I've peppered just really subtle, sometimes subtle hints of safeguarding. So I've written things about the dad smelling of alcohol. I've sort of given some history of some non-accidental injuries. I've coded a few DNAs. I've put a written disciplinary in. I've done lots of little things. So I'm hoping that we're able to demonstrate that's what Heidi's done. So Heidi's now written the safeguarding report draft for me, and you just come back into EMIS and you just paste it in there. And I don't know if we want to make this a little bit bigger just for a second, just to bathe in the richness of what's been generated. It's pretty decent. I'm really eager to see if it's picked up on the nuanced things that, okay,
Yeah.
great. So it's little things like that, missing
Yeah.
developmental checks, which weren't even coded as DNAs.
Dental caries as well, small burn
Dental
marks.
care, subtle, yeah. Well, not, yeah. And then withdrawn, even things like that. I'm really hoping, yeah, it got it. I just put a one-liner in there about the dad smelling of alcohol once. This
Yeah.
is next level. This is not a substitute for me using my brain. This is just the start. This is, I'm doing this, I'm pulling some notes, and it knows to keep it all completely anonymized, no third-party information about other people. All of those things are built in, which is, yeah, enormously time-saving.
And I think the thing to call out, which we did already say, you said earlier, Sam, is that to make sure, as the clinician writing it, obviously to read through and make sure it accurately reflects, the document that you need to send off.
So as I said, this has been built for the ICB, and they were sort of interested in how we can make this safe, and as was I. So we have suggested that for this level, it is absolutely doctor only. It's recommended that you have some training around this because you're handling data.
Mm.
And that segues into another point that for the second case that I wanted to talk about is what my process is to make the patients aware of what we're doing. Anytime a request for a document comes into our practice, we send them a generic message, which is, I guess, the equivalent of what we used to do of time stamping it. We used to date stamp everything as it gets brought into the practice. And in that message that they're being sent, it makes them aware that we're going to be using software, which is going to help us process their document requests within 28 days. So it's giving them all the standard information that we want to give patients, acting as a timestamp, but also just making them aware that we're doing this and that they can contact us if they want any further details. And that's the kind of thing that the data protection officers want to hear, is to show that you're demonstrating safe use and consent. So this is a fictitious scenario of someone needing a universal credit form. And again, I'm aware of different practices. I don't know if you have any experience of whether you used to do it, or I don't know if you had any kind of baseline for us to work from on that, Hannah. What's your go-to with universal credit?
Yeah. It's been a while, to be honest, Sam. But I remember, sort of slightly dreading having to compile all of the information, right?
Yeah.
Yeah.
It's that handwritten form. It comes in, it's about, I think maybe 6 leaves of, it depends actually, they vary, but yeah, it's a number of sides of A4. It's written by hand by a lot of people, and my hands don't write very well. But in some places, it's just not done at all. They will write back to Universal Credit or to the DWP with a generic summary printed from the record, just a brief summary, and it doesn't do it justice. So we will recognize these questions from that form, and that's what I've done. I've lifted from the form directly. I've asked it the specific questions that they want us to answer. Actually, when I did this yesterday, I didn't have any fun answers or interesting answers for these 2 questions, which appear at the end of the form. So I have since gone back into this record, and I've hidden a few things in there, which I'm really hoping are picked up on, because I've always found this quite stressful. Like, how can I possibly understand the breadth of someone's record to know whether or not that they've been at any point threatening or abusive? If you've got really good governance and you've put a flag on the account, great, but if they transferred from somewhere else, you can't always guarantee that. And I used to spend my time searching for keywords like behavior, warning in the records, and computers can do that much better than me. So why not empower Heidi to do this for us? And so again, same process. I'm taking that pre-populated information lifted through EMIS, and I'm putting it into the Ask Heidi box. And it's taking a little bit of time, which is good, but less time than me to write it. And let's see what it generated. Perfect. So it's written it really neatly under these headings for me. And like this level of detail, I would not have the time to provide. I'm trying to estimate, I think 15 minutes if I was doing a really good job. If I was doing a poorer job, maybe a couple of minutes and a few scribbles. But what this is about is advocating for the patient. The next step from this form, when we send it in, is they're going to the DWP, they're going to have an interview. And if you can give this wealth of information for them to draw on, it's going to have a better outcome for them. The patients are going to feel more heard. And crucially, it's not making anything up. It's just listing from what's there. Oh yeah, and it did. It pulled up, as I said, I peppered some little nuggets in the record. And again, that's great. Just imagine this patient not being able to travel, the fact that we've highlighted that and made it really clear that that could be a problem, but also that we've signposted safely. But this is one that is based on a real case for a patient that I saw. this was a lady who kept coming back to us with sort of different body pains, very non-specific. And I'd seen her a few times and I recognized that I wasn't achieving anything. She was coming in, she would say a sort of similar story. She wasn't a particularly great historian in the sense of wouldn't give me much detail of what would make things worse, better, and all the Socrates questions. But I recognized that, and she just kept coming back to me and others and getting stronger and stronger and stronger painkillers. I don't think this case is unique to any particular general practice. We all can relate, right? So what I did was, before a particular consultation with her, I wanted to summarize. I wanted to spend some time in the consultation looking back at what we had done and realizing that actually we weren't doing that well. We were just going around in circles. So one of the templates that I've built is a fully customizable one, and I've labeled it a "To Whom It May Concern" letter. And what I've done is just some prompting questions to try and give Heidi as much as possible to work from. So in this case, what I did was I said, I want to create a summary. I want to outline previous efforts, medications, interventions, and consultations, I'll say, for this lady's pain. And then the purpose is really to help guide us in our next consultation to find, I don't know, that's too woolly, let's keep it brief. And then that's going to go to me and the patient. So it's just giving the context. Those of us who use prompts will know that it's all about the context. And then, yeah, so it's drawing from the record. And in this particular scenario, what I did was I printed this out and I gave a copy to the patient in the waiting room. And after reading it, I just generated 5 quick questions, really simple ones. But what I wanted her to do was just take stock for a moment, for us both to reflect and think about what we could do differently. Again, because I've been into the record and added all these bits and bobs, I tried to make it clear with this fictitious cases that there'd been a real escalation of the pain. But it's just great to give that chronology again, like you said, Hannah, time stamping. It's grounding, isn't it? It's more detail than sort of wishy-washy. This is on this date, this happened, we did this. And so this patient wasn't in this case angry, but some patients who do and might find our care frustrating, being able to show them that actually I have done quite a lot. I've certainly tried. It is really transformative.
Yeah, amazing. Wow. And how was that received, Sam?
So well, honestly, it completely changed everything about this patient. And just, I think the crux of it was we had made false assumptions. She was too embarrassed to ask about what she actually wanted to ask about, which is really at the social context that we'd missed. But by showing this, asking this questions, using this as a kind of really non-judgmental approach to that, just completely changed stuff for me.
So, and actually, I feel like this type of example, because obviously this is not, solely based on an actual patient, but pulled different kind of threads of the cases. But I think this is the exact reason of why I love Heidi. I feel like it gives us that, when I talk about like a superpower, we went into the profession to embrace that human side of medicine, right? To be able to put our hand on someone's shoulder, to be able to support them and empathize and communicate effectively. And with all of the admin burden of modern day general practice, it's become almost impossible to be able to do that or optimize it, for sure.
I was going to say that's what's been eroded, and that's what I found. The more senior I've become, and the more responsibilities I've taken on, I've missed that trainee. I guess it was a superpower of sorts. Time. I had the time to actually dig down and ask all of those long questions, and being able to do something like this, you just feel good afterwards. I would feel I'd feel so sort of downtrodden if I had another consultation with her where we didn't achieve anything, but we both came away from this consultation feeling so different.
Amazing. I love that. Thank you so much for sharing, and for educating. I mean, I've learned loads in this hour that we spent together, Sam, so I really appreciate it.